Happy. Right. Welcome back, you all, for the OET speaking class, and let's start again. Yes. Yeah. Okay. So it seems like everyone is getting into the class, and it might become like noisy becomes because still everyone is getting on it day, right? Log වෙන ගමන් නිසා තාම පොඩක් sounds එහෙම අපිට නිකන් ඇහෙනවා. Log වෙනකොටම mic on වෙලානේ on වෙන්නේ. එකතු වෙන්නේ. Yeah, because of that reason, right? Okay. So, yes, we're gonna start our OET speaking class. So where we are now. Yeah, so it's our first class to summarize what we have talked in the class. Yeah, that's good. Yeah, so so if you're a new student to the class, the first thing is just to watch the recordings. Yeah, because we have done 2 sessions and today is the third day after speaking class. We started, we did some introductions, and yeah, and the last week, okay, we continued. So last week actually we did how to we already know the kind of the situations that comes in our scenario, the cue card එකේන situations මොනවද කියලා අපි දන්නවා. Yes, in different situations they are giving different situations for us, not like hundreds. සිය ගණනයක් නෑනේ. So we have some limited places where these conversations going on, and then ඊට පස්සේ තව මොනවද අපි කතා කරේ? Yeah, තව අපි කතා කරා අපි කොහොමද අපේ conversation එක start කරන්න කියලා. How to introduce yourself. ඔයාව කොහොමද introduce කරන්නේ? And also we practice how we are asking the name of the person. right? So we have inpatients, outpatients. So depending on whether they are inpatients or outpatients, we decide the patient is a stranger, a new person, or a known person. So we have known and unknown persons due to the categories. Yeah. And so we identified, we discuss all these things, taking some cue card questions. And also we did some practice sessions last week. So yeah, if you're really new to the class, it's mandatory to go and see the recordings of the first two classes. Still all of you are new to the class, but yeah, it's the third speaking class we are doing today. Yeah. So up to now you have an understanding. Yeah, up to now you have an understanding. And I believe that you have practiced this part. අපි ඉගෙන ගත්ත part එක දැන් practice කරලා ඇති කියලා මම අනුමාන කරනවා. මගේ අනුමානය හරි කියලා මම විශ්වාස කරනවා. මොකද ඒක practice කරන්නේ නැතුව මුකුත්ම කරන්නේ නැතුව නිකම්ම class එකට join වුණාම that doesn't work because OET is just not an exam. If you එක හරියට practice කරන කෙනාට it's nothing. Yeah, it's nothing for a person who practice a lot, who do lots of reading papers, who do lot of speaking sessions and writing answers, and you have to be really active in the class and also in your real life also you have to practice these sessions. So the practice decide whether you'll be confident enough to go for the exam after this 3 months. මේ මාස
මං
තුන
කියන්නේ හරියව වැටුණ කියමුකෝ ඔක සීඑන් මැඩම් කියන
නේද?
දුරදි ගියයි කියලා මං අහන්නේ.
Several stories are there, right? So yeah. මම දන්නවා ඕගොල්ලන් ගෙවල් වල ඉඳන් තමයි ගොඩක් කට්ටිය අවධානය ක්ලාස් එකට ජොයින් වෙන්නේ කියලා. ඉතින් ඕගොල්ලන්ගේ සම්පූර්ණ අවධානය ක්ලාස් එකට දෙන්න පුළුවන් නම් ඒක හොඳයි. මම දන්නවා ගෙවල් වල නේද? නේද බබාලා ඉන්නවා. ඉතින් ඔය නොයෙකුත් දේවල් එක තමයි තාමත් කට්ටිය ජොයින් වෙන ගමන් නිසා ඔඩියෝස් වීඩියෝස් ඔක්කොම ඔන් වෙනවා. කන්ට්‍රෝල් කරගෙන අපි කොහොම හරි ගමන පටන් ගමු. හරියටම on time ක්ලාස් එකට එන්න try කරන්න. එතකොට අපිට හරියටම විනාඩියක්වත් නාස්ති කරන්නේ නැතුව අපේ ක්ලාස් එකේ වැඩේ අරගෙන යන්න පුළුවන්. හරි? right. එතකොට ඉතින් ඕගොල්ලන්ගේ අතේ තමයි වැඩේ තියෙන්නේ ඇත්තටම. We can direct you. Yeah, the teachers direct you. And yes, අපි ඔයාලව මේකයි කරන්න ඕනි කියලා දෙනවා. මේ exam එකේ මේකයි බලන්න කියලා දෙනවා. හැබැයි practice කරන part එක ඔයාලගේ අතින් අඩු වුණොත් එහෙම කරන්න අමාරුයි වැඩේ. මොකද ඔයාලා ලොකු කාලයක් ලොකු වියදමක් කොහොමද අරලා මේ exam එක කරන්නේ? ඒ නිසා හැමෝම exam එක pass වෙනවා කියන අදිෂ්ඨානයම ඔළුවේ තියාගන්න because it brings a fortune for you actually, right? ස්විප් එකක් ඇදුනා වගේ වෙනවා ඊට පස්සේ. Yeah, you can fly whichever the country. හිතන්නකෝ ඊළඟට රිසල්ට් එක ඔයාලා මේකේ සර්ටිෆිකේට් එක අරගෙන නේද ඊට පස්සේ රටවල් වලට ඇප්ලයි කරලා එක එක්කෙනාගේ ඩ්‍රීම් කන්ට්‍රීස් තියෙනවානේ. ඒවට ඇප්ලයි කරලා ඔයගොල්ලන් ඉන්ටර්විව් පාස් වෙලා නේද ඊට පස්සේ ඔයගොල්ලන්ට ඒ වීසා වැඩ ටික කරගෙන නේ shopping පාරක් හිම දාලා ගෙදර කට්ටියම නේද ඒවා ටික කරගෙන ඉතින් නේද ෆ්ලයිට් එකක නැගලා යනවා කියලා කියන්නේ ඒක ලොකු දෙයක්නේ. So that is your actually dream. The dreams කියනම නිකම්ම success වෙන්නේ නැහැ. We have to work on our dreams. If not, they are just the dreams. ඒවා නිකම්ම dreams විතරයි. ඊට පස්සේ we have to work on it. So then dreams become true stories, right? Okay. So that's about the motivation. So yeah, just focus on to the class and you have to actively participate for the class. Then සමහර අයගේ videos on වෙනකොට මට තේරෙනවා they are not likely to participate for the class නේද නිදාගෙන නේද එහෙම කර වෙන කතාවල ඉඳගෙන තමයි ඉන්නේ. එතකොට නිකන් අර ක්ලාස් එකට ආනන් ගිහින් බලනවා මොකද්ද වෙන්නේ කියලා චුට්ටක් ඉඳලා බලනවා. නිදිමත ඉතින් ඇඳේ ඉඳගෙන මේක වැඩේ කරන්න බෑ. දැන් රෑ තියලා මම දන්නවනේ රෑ තමයි ඇඳේ ඉඳගෙන වැඩේ කරන්න බෑ. නැකිටලා තියෙන මේ පොතක් තියෙන මේසයක් තියෙනවනේ සාමාන්‍යයෙන් ඕනම ගෙදරක. එතකොට එහෙම ක්ලාස් වෙලා එතෙන්ට එන්න videos on කරගන්න පුළුවන් ඕගොල්ලන්ට. ඕගොල්ලන්ව motivate කරගන්න පුළුවන්. කොහොමද? yes, video එක on කරගන්න මේ නොදැනුවත්කමින් video on වෙන ඒවා off කොහොමරි ඒක මම off කරනවා මම දැක්කොතින්. එහෙම නැත්තම් purposely ඔයගොල්ලන්ට videos on කරගෙන class එකේ ඉන්න පුළුවන්. right? ඒක ඔයගොල්ලන්වත් motivate කරනවා මං හරියට වැඩේ කරනවා අද දවස ඇතුළත කියන එක. හරි? Right. So that's the briefing section and so to the lesson straightly. Right. Okay. So yeah. ඔන්න මම ඔය කිව්ව දේවල් ටික තමයි අපි කතා කරේ and also we practice how to ask questions and also we practice actually to ask questions from the patients and also due to some situations we need to know what questions to be asked from our patients. Normally actually in Q cards they're directing us like so what sort of questions to be asked from our patients නේ ඔයගොල්ලන්ට මතකයි last week හිටියනම් onset එක අහන්න කවද්ද මේ කියන්නේ onset කියලා කියන්නේ පටන් ගන්නකනේ ඒ කියන්නේ initial පටන් ගත්තේ කවද්ද ඊට පස්සේ frequency එක අහන්න හැබැයි ඒක අහන්න ඕනේ තේරෙන විදිහට patient so don't forget that you're dealing with a patient and there are some sort of things that they can understand yeah not the medical terms, but just a normal way of asking the questions from our patients. And also the questions have to be really related to the Q card. So those are the things that we discuss, right? So whenever you're asking questions from your patients, so that is actually ගොඩක් වෙලාවට අපිට සිද්ධ වෙන්නේ patients ලාගෙන් questions අහන්න තමයි මුලින්. Because for that actually we call information gathering. Yeah. So we need some information gathering in most of the situations. Some other situations, information gathering part එකක් ඕන කරන්නේ නැති තැන්. මම ඒවටත් examples ඕගොල්ලන්ට last week එකේ කිව්වා. හරි? right. එහෙම ඕන නැති දේවල් තියෙනවා. නමුත් ඕන ඒවාත් තියෙනවා. but අපි commonly main steps ටික follow කරගෙන යමු. ඊට පස්සේ අපි situations වලට යනකොට අපේ role plays වලට යනකොට so then we'll discuss whether which parts are necessary for which situations. Okay, right. So information gathering is actually the main part that we'll meet in most of the cases, right? So remember, before asking the questions, before asking any questions from the patient, we have to say what we're going to do. Right. Do you have any problems with the connections? And someone is saying that he can't hear properly. So what about the others? Do you have the same problem? No. So which means Mr. Ho kata or Miss Connect. Maybe you have some connection problems with product balan. The all others can hear properly. Right. Thank you for okay, thank you. Right, so what I'm going to tell is, what I was talking was, before saying anything for your patient, before asking anything, we have to let them know what I'm going to do with them, right? So if you want to ask questions from your patient, let them know that you're going to ask the questions from you. And also if you can mention for what reason, in order to do to do the diagnosis or for what reason or for what purpose you're asking the question, right? That's a purpose actually. So just to give any explanation or to give advice or to do anything else, මොනවට හරි මොකක් හරි අරමුණක් තියෙනවනේ අපි දෙයක් කරන එකේ. OET class and OET exam එක ලියන්න. That's a purpose of participating for this class because we have an exam to pass. So each and every of these steps, there's a purpose. So before asking the questions from your patient, it's better to say or to inform them what you are going to do with them. Okay, so that's actually the best thing that you can do. Let me show you how you can ask it from your patients. And also I'm saying this, you don't have any tudes regarding this. You don't have any tudes. I have shared only one tude with you. But if you feel like this is more important, so you can write it down because these are small phrases. For each of these phrases, we don't need the tudes. I'm providing the tudes regarding the transcript. But for the explanation parts, That's just a small phrases are there. So I know that you all can write it down in the book. Yeah, I know that you're maintaining a book for the speaking, and when you're just writing actually, so you could remember the phrases. Then you're just taking a printout. Okay. So for that reason, you don't have any tunes regarding this. Like the what I'm going to share now. මම share කරන එක සම්බන්ධව tunes නැහැ ඔයගොල්ලන් ගාව. So don't ask that question now. You have the answer, okay? Right. So yeah, you have the topic here. What is the topic actually? Transitioning from the introduction to history taking. Yeah. So අපි කලින් කරේ මොකක්ද? Introduction එකනේ. I'm introducing. Yeah, I'm greeting. I'm introducing myself for my patient. And also I'm asking the name of the patient. Yeah, how can I call them? So then I know how to call them. Right. So after this introduction session, also we discuss some sort of questions. But before asking the questions, yeah, question means actually history taking. යාගේ history එක දැනගන්නවා කියන එකනේ. So there's medical history කියලා අපිට වෙනම ගන්න පුළුවන්. Medical history and also the social lifestyle history එකත් අපිට ගන්න පුළුවන්. Lifestyle questions ගැනත් අහන්න පුළුවන්. So ගොඩක් වෙලාවට අපිට lifestyle questions වලට වඩා ඉස්සල්ලා මුලින් අහන්න වෙන්නේ medical history එක. නේද? මොකක් හරි දෙයක් සම්බන්ධව අපි ගාවට ආවම. So commonly we'll call it like history taking. And so you see there's 4 phrases here. All these 4 phrases are equally correct. Though you are saying the first thing, the first phrase, or the second, or the third, or the fourth, whatever is correct. So these are options. Yeah. So if you're writing these out, if you like, you can write the 4, all 4. If not, I don't mind that you're selecting 1 or 2 from here and write it down. Because you don't need all 4. ඔක්කොම ඕන නැහැ. These are options because we don't need all options, okay? Yeah, just 1 or 2 is enough. So yeah, so these are some phrases or the sentences to tell before asking questions from our patients. So the first one is says, okay, before proceeding further, I'd like to ask you some questions about your pain. Is that all right? Always we are saying what we're going to do and also asking whether it's okay with the patient. Yeah, so yes, so many of you are living in many නෙමෙයි අතරම few. සමහර අය UK වල ඉන්න ගොඩක් කට්ටිය එදා අපිට කතා කරා introduction session එකේදී, and also some are living in some other countries like Dubai, and yeah, I met some students like that, right? So many of you have said that you're already in UK, so you know what I'm saying. And also the other students just understand, yes, we are saying something for our patient and then we are going to get the consent from our patient. Consent, agree karagana whether we have taken it. Yeah. Okay. So we are just checking the consent කියලා කියන්නේ just in yeah, we are saying, is that all right with you? Is it okay? Yeah. Always we are saying that. Yeah. You see all these 4, it says like that. Yeah. The first one is, okay, before proceeding further, the කමා එක කියලා කියන්නේ අපි නිකක් නවත්තලා කතා කරනවා කියන එකනේ. Okay, before proceeding further, I'd like to ask you some questions about your pain. Is it all right? I'd like to start by asking some general questions to understand your condition. Is it okay with you? So that sentence also have to be followed with the check understanding question. Is that all right? හරි ඔයගලන්ට පේනවා ඊළඟ phrases වල තව එකක් attach කරලා තියෙනවා. ඒ වගේ මොකක් හරි එකක් අන්තිමට එන්න ඕනේ. ඒක දෙවෙනි එක ඔයාලා choose කර ගන්නවා නම් ඒක ලියා ගන්නකොට මේ ඒ වගේ part එකක් add කර ගන්න. Okay? The third case, to give me a better understanding of your situation, is it okay if I can ask you some questions? if you don't mind, or come up that done, I'm just going to ask you some few questions about your lifestyle. Would that be okay? Okay, so these we have 4. Now, where we are asking after the introduction, before asking questions or before asking anything, before starting history taking, before if we need the details, right? අපිට යාගෙන් තොරතුරු ගන්න තියෙනවා නම් මොනවා හරි ඒ තොරතුරු ගන්න කලින් මෙහෙම කියනවා. හරිද? So, now this is called actually history taking, yeah? History taking. So before asking the questions. So once again, if you could repeat after me or repeat මගෙත් එක්කම කියන්න පුළුවන් ඕගලන්ට it doesn't matter you're all muted උගල mute කරන් ඉන්නේ but it doesn't matter just read it with me so then the words the pronunciation of the words comes to your mouth. Okay, the first. Okay, before proceeding further, I'd like to ask some questions about your pain. Is that all right? Second, I'd like to start by asking some general questions to understand your condition. Is that all right? Third, to give me a better understanding of your situation, is it okay if I ask you some questions? Fourth, if you don't mind, I'm just going to ask you a few questions about your lifestyle. Would that be okay? Right? Yeah. So it's a good idea to provide a rationale or a reason or asking the question, sir. They'll give, the patient will agree, okay, go ahead. කියලා මොකක් හරි short answer එකක් ඔයගොල්ලන්ට provide කරයි. And then after that, you can ask the questions one by one from the patient. Don't now make sure that you're not asking multiple questions at a one time. Means එකපාර ප්‍රශ්න ගොඩක් අපි අහගෙන යන්නේ නෑ. ඇයි? What happened if you ask compound? So we say, yeah, compound questions. What happened? The first thing you will lose mark. Compound questions ඇහුවොත් ලකුණු අඩු වෙනවා because දීලා තියෙනවා information gathering part එකේම. I think I shared that part with you last week. So if whether you're asking compound questions. So our compound questions are when නැතිනම් තමයි mark එකක් එන්නේ. ඇහුවොත් ඒක නැතුව යනවා. So make sure that you're not asking like sort of bunch of questions at a one time. So don't ask the questions one by one. Okay, right. So I have some other options, but I'll give like 1 or 2 minutes if you want to write it down. Yeah, I know මම කියනකොටම ඔයාලා ලියලා ඉවර ඇති ගොඩක් කට්ටිය, but if you need some more time, I'll give another 1 more minute. Yes, I'm in London, miss. This is not actually a PowerPoint, miss. I'm absolutely sorry. I can't upload it to the group. I can't. This is just a part of a book. Yeah. So yeah, I'm sorry. I'm just sharing whatever you need and I'm giving the time for you. And even you can take the screenshot, but I'm providing some other sort of tudes for you. But unfortunately, I don't have the tudes made from this. Sorry. Okay. And I'll share whatever you need. Yeah, there are some tudes I made. Yeah, I'll share them with you. Okay. Yes, right. I think you note it down and I'll move on to the next session. So, yeah, right. Yeah. And also there's another one. If you don't mind, I want to ask some questions about the medical history. It will help me to access your condition in a better way. So we are telling the purpose of it, right? Okay. So, yeah, this is another thing. Yeah. To ask permission before moving to the information gathering stage. So these are some other things. These are some other ways of saying. Now, the first thing, for example, can I start with questions about your lifestyle before discussing treatment options? So now, if the cue card gives a kind of a task to ask questions about the lifestyle, maybe about the eating habits, their whether they are doing any exercises. So that is related to their lifestyle. Ne? The drinking, eating habits වගේ දේවල් කතා කරන්න කියලා තියෙනවනම් you can say the first sentence. What? Can I start with questions about your lifestyle before discussing treatment options? May I ask some questions about your family history? I'm going to ask you some questions about your lifestyle. Is that okay? It's okay if I ask some questions about your lifestyle. So, ඒක ඇත්තට මේක ලියන්න ඕනෙත් නැහැ ඔයගොල්ලන්. නිකන් just මේ topic එක ඔළුවට දාගන්න before asking questions, before asking any type හැම question question එකකටම මුලට අපි මේක කියන්නේ නැහැ. So, just to start එකේදී විතරයි මේක එන්න ඕනේ. Questions and what is this? Information gathering stage එක. Start කරන්න Kali, right? Yeah. So just yeah, these are some other examples, and I don't think that you need to write it down because it's just normal. When you get used to it, that's really easy for you to answer questions. Yeah, is it okay if I ask some questions about the lifestyle? Yeah, even you can mention the name of the person because now when you're coming for this stage, you already know the name. So we'll examine that the name of the patient is Joanna. So, Jonah, is it okay if I ask you some questions about the lifestyle? So, Jonah, may I ask some questions about your family history? Is it okay with you? Yes, please. Yeah, that makes actually that seems that you're really polite. Yeah. Yes. So we have to be really polite in sense in our profession. So yeah. Right. That's really good. Okay. It doesn't take seconds to say this sentence always. Right. So then another. So there are some places where we need to take the sensitive details. Sensitive මොනවද? සමහර personal questions තියෙනවා අපිට අහන්න ඒගොල්ලන්ගේ. මොනවද ඒගොල්ලන්ගේ මෙන්න මේ වගේ. sexual history ගැන අහන්න වෙන අවලාවල් තියෙනවා. ඊට පස්සේ සමහරක් වෙලාවට ඒගොල්ලන්ගේ මේ alcohol intake එක smoke කරනවද? ඊට පස්සේ ඒක දැන් හිතන්නකො pregnancy towards නේද? questions නම් miscarriages වෙලා තියෙනවද? ඒ වගේ sensitive questions අහන්න වෙන තැන් තියෙනවා. එක එක scenarios අනුව වෙනස් වෙන වෙලාවල් තියෙනවා. So, yeah, in that case, again, it's the same thing. Yeah, it's the same thing. So yes, if it's all right with you, I need to ask some personal questions. If you don't mind, I'd like to ask some questions about your sexual history. Do you mind if I ask some questions about your lifestyle? Again, it's related to the lifestyle. So you see that all these set of questions are, or the way of asking the questions are all same. Yeah, you don't have to write. Now, if you note the first set of phrases or the questions, now you don't need to write it. Because now you already know whether you have to answer those questions, just to say that part before asking the questions. Is it clear? Yeah? So whenever you have a question, pop it out. You can raise your hand and ask it. Okay? So don't keep it like in your head. සමහර කට්ටිය ප්‍රශ්න එනවා. ප්‍රශ්න ඔළුව තියාගෙන ඉඳලා ඉවරුණාට පස්සේ question එකක් චරිත හරහා එවනවා. So then I can't answer commonly for that question. නේද? එතකොට මට commonly එකට answer කරන්න බෑ. ඊට පස්සේ මම ඒකට වෙනම answer කරන්න ඕනේ යාට. So if you have questions related like for the lesson, just ask it in the same lesson, the same time. That's easy. Right. Okay, right. Yeah, and this one. To justify a specific line of questioning. Justify කරනවා කියලා කියන්නේ a specific line of questioning. So this is actually what I said before. Why I'm asking these questions. So sometimes, yeah, even when I'm working also, sometimes the people comes and ask why I have to do this. Always they are questioning actually. It's not like, so most of us Sri Lankans are now okay. I think they're questioning now, but most of the people are not questioning. If someone says to do something, then they are already doing it without asking question, and they don't raise their voice to ask why I should do this, for what purpose I have to take this medication. So yeah, you meet more people, right? You meet more people and they're not questioning from you. If you say to take this medication, 1 at night and 2 in the morning. So they're not questioning, why should I have to take this medication? For what purpose? Most of our people are not asking, but it's not like the same in other countries. They're asking. Yeah, they're not asking. So you have to give the answers. Yeah. So in that case, it's better to give the instructions or to tell the purpose first. And that's all clear. In the OET exam, it's totally good. Yeah. So to justify a specific line of question means you're giving the particular purpose for what I'm asking. Why I'm asking your family history? Because the condition can be hereditary. Yeah, even they have dementia, they question us. They don't forget to ask questions. Even they have the dementia. Yes, that's true. Yeah, the questioning part is really important. And sometimes we find that some of the people are really rude if we don't give the kind of the purpose or the explanation part. Yeah. So why I'm asking your family history? Why you need my family history for? I've been here to get some medications. You're asking my family history. Why you need my family history? So I'm asking the questions because why? Your condition can be hereditary. So in that case, the medication won't answer. Have to go for another step forward. Yeah, and that's why I'm asking. So it's better you're explaining this before they're asking from you. So since this condition can be hereditary, I'd like to ask some questions about your family history. Okay, then that's okay. And so you have another option here. If you don't mind, I want to ask some questions about your sexual partner or sexual practices. I can appreciate that these questions are very personal, but they're crucial for the examination, I'm afraid. Yeah, so yeah, always try to give a reason. Yeah, always try to be practical. So now you can remember the steps, right? Yeah, we greet our patient. Yeah, when we are starting the role, we greet, we introduce, and we are asking. So in the introduction, so there are different ways of introducing in different situations. You can remember. So yeah, maybe we are dealing with strangers, which means the patient is really an unknown person. So in that case, that's totally different, which means like we have to ask the reason why they are visiting us. Sometimes you are dealing with the known patients, for example, like the ward patients. So in that case, you know for what for what reason you're speaking with the patients, right? So once you finish your introduction, then comes for the information gathering stage. In some scenarios, not all. 100ක් තිබ්බොත් ඒ 100ම මෙහෙම question කහන්න නැහැ. But questions අහන්න තිබ්බොත් මතක තියාගන්න. Before asking the question, we have to let them know. Yes, like this. මෙන්න මේ විදිහට. Yeah. And also ඒක මෙහෙම මාරු වෙන්නත් පුළුවන්. Now, for example, task එකේ now you have seen some cue cards, right? In the first task, they're asking you to ask some to take the medical history from the patient. And in the second bullet point, they are asking you to ask some different type of questions, like personal questions about these things. කියලා දීලා තියෙනවා example. මේවා ගැන අහන්න කියලා. So එතකොට task දෙකක්නේ. එතකොට දැන් එකම ගොඩේ questions ටික දැන් හරි ඔක්කොම questions නේ ඔක්කොම අහගෙන යනවා කියලා අහගෙන යන්න නැතුව පළවෙනි task එක ඉවරනාට පස්සේ after you have taken the medical history of the patient, and then after that what you have to do is you have to say, okay, now let's move into the second නැත්නම් මොකක් හරි අපි කියමුකෝ මෙහෙම after you have finished the first part, let your examiner, the interlocutor, know that you have finished that part and you're going to step on to the next. Right? So in this stage, I'm going to ask some questions about your lifestyle, some personal questions. Is that okay with you? This is just to give a good understanding to take a good understanding about yourself. This is crucial for the diagnosis. Is that all right with you? Likewise, you can let them know. Yeah, right? So always it's better. So if the tasks are different, the first one is to take the medical history, the next one is the social history. So it's good if you can mention that okay, so first it's medical history, now you're asking social. So the patient knows what you're asking. Yeah? So I think you understood what I'm saying. Right. No, you don't need that part. Now, let me check what I can do next. Yeah. Right. And before that, yeah. The next part is this. මට ඔයගලන් මේ ටියුට් එක ඇත්තටම හදාගන්න බැරි මේ I'm taking some parts from different places. So it takes big time to have this all one in a tune. But I try my best to give a good thing for you, right? Okay. Right. So the next thing, after you have taken now දැන් මොකද්ද? So දැන් අපි කරපු part එකට මේක crop කරගන්න බෑ. Yes. I think it's good now. Yeah, I'll show you. Right, so now we are getting the permission. අපි ඒකට කෙටියෙන් කියමු permission ගන්නවා කියලා, right? So what I mean by to take the permission, yeah, I mean like just to let them know what you're going to do. And then you're asking the set of your questions, okay, one by one. And after taking the informations, after asking questions from your patient, it's good if you can summarize what you got from the speaking. Now, this is depend on the situation, right? So think that you are in the A&E, accident and emergency, and you're taking details. Yes, completely a stranger, but we are a life-threatening stage එකක ඉන්න person කෙනෙක් කියලා හිතන්නකෝ. Yes, life threatening. ඒ කියන්නේ යා කතා කරගන්න අමාරු තැනක ඉන්න වගේ patient කෙනෙක්ද එහෙම නැතිනම් especially මම මෙහෙම කියන්නම්කෝ ඔයගොල්ලන්ට මෙහෙම if you are going to administer a medication for your patient or to give an injection or if they are asking a medication from you in that case it's good if you can summarize the details for the patient because why if you have taken them, especially after taking the medical history, social history වලට වඩා medical history එකක් patient කෙනෙක්ගෙන් ගත්තට පස්සේ it's better to summarize it. Just to confirm you got the right detail from the patient. Now, for example, like you're asking from the patient, do you allergic to anything, for any medication or any food? Especially for the medications, yeah? Yes, do you allergic for any medication? So the patient says no. But sometimes he's allergic to something, but he forgot to tell it to you in the first part. So when you're summarizing, yeah, when you're summarizing, you say, okay, so you said that you're not allergic to anything. So then he could remember something else. Yeah, so that is why it becomes practical. After you have taken medical history, not the social history. It's not essential to summarize the social history for the, okay, so you said that you're not exercising. So it's okay. ඒක කරත් නොකලත් ප්‍රශ්නයක් නෑ, but මතක තියාගන්න medical history එකක් ගත්තොත් අනිවාර්යෙන්ම summarize කරන්න යාගේ details ටික. Yeah. So after asking questions, so which means you are gathering informations, you have set of information, but now you want to clarify it, whether it's the right information you got. He's not allergic to anything, and he said that he is taking some medications for some other type of a condition, kind of a herbal treatment, and it could be yeah, it could be kind of important information for type of the diagnosis that you're going to make after that. So yeah, especially the medical history, it's good to summarize the details. Okay, right. So I'm going to show you how you can do this part. Yeah, so you see there's an example. I'll highlight it so then you can see it clearly. Yeah, this is an example. From what I have understood so far, you have been experiencing indigestion for the past few weeks, and at times it's accompanied by headaches, which last for a few hours and only relieved with medication. You feel indigestion is caused when you eat rice for dinner. Is that right with you? Or else? Okay, miss. Right. Okay. So, yeah. So if you want, you can write it down. Just as an example, this is not what you're summarizing always because it depends on the information you're taking from the patient. Okay? හැම වෙලේම informations අනුව වෙනස් වෙනවා. So මේ තියෙන්නේ මෙයාට පල්ලෙහෙන් පේනවා. මේ තියෙන්නේ ඒ වගේ template එකක්. In summary, it seems that කියලා patient ඔයාට කියපු symptoms ටික කියාගෙන යනවා. ඊට පස්සේ අන්තිමට යන have I covered everything? Is that right? Is there anything else to add? Yeah, ඔයාට මොනවා හරි add කරන්න දෙයක් තියෙනවද? මේ ටික හරිද? Have I covered everything? Is it all? Is it all? මේ ඔක්කොමද? Like first you are taking a clarification from the patient and then after that we can move on to the next session, which is to give information or providing information part. Yeah. So you're taking information, you're gathering all and give back to the patient. Okay, so what? So then again, that's another part, right? So these are kind of examples. I'm just going by step. So you could understand what I'm saying, right? So from what I have understood so far, I've been experiencing indigestion for the past few weeks. And at times it's accompanied. Accompany කරනවා කියලා කියන්නේ ඒත් සමගම එන දේවල් නේ. Indigestion එකත් එක්කම ඔයාට ඔළුව කැක්කුමක් එනවා. Which lasts for a few hours. පැය ගානක් පැය දෙක තුනක් තියෙනවා. And only relieved with medication. Pendol hari මොනවා හරි ගත්තාම තමයි හොඳ වෙන්නේ. You feel the indigestion is caused when you eat rice for dinner. ඔයා හිතන විදියට මේ රට බත් කාපුවම තමයි මේක වෙන්නේ. ඔයා හිතන විදියට. So is that right? So this is what patient said. That's what I'm summarizing. So it depends. Yeah. You can't say the same thing for every patient because it depends. So yeah, the second option is actually a template. Yeah. So it's in summary, it seems that, and then you could say the symptoms and you're just saying the last one. I'll give 1 minute again. Right? Done. Done and dusted. Okay. You know, it's 6:17 now. It's still cloudy, but it's like, no, not like dark. It's not sunny, it's cloudy, but it's the sunlight. The light is there. Even like past 9 o'clock, I think. So today's sunset is like 20 past 9. And it's a bit raining outside. Drizzling. Yeah. So it's different culture, it's different climate. So after doing this OET exam, you are gonna expose to a new culture, new people. Everything is gonna be new. So yeah. Even when you do this OET exam, you're realizing that like it's a bit new thing. Yes. As you are professionals, so you have to be polite. So sometimes the patients can be rude. So sometimes it happens, but there are several actions to be taken by the hospital. So yeah, sometimes. Right. Okay, so you said you done it, right? Yeah, that's what I want to share with you. Okay, we're gonna practice this part now because we add something new today, and we're gonna practice this small, and we'll see whether we can do it properly. If so, we'll move on to the next stage because the next stage is completely another subtopic, which means information giving. Before that, yes, before that, I have something to discuss with you. It's actually about the PowerPoint presentation. Oh, no, not the PowerPoint. මටනේ PowerPoint presentation එක තියෙන. ඔයගොල්ලන් මම share කරේ PDF එකක්නේ. Yes, so the PDF I shared with you. Right. Yeah. So actually last week we started this part, but I need to complete this part with you. So it was all open questions. Yeah, you remember. Open. Open and awkward. Yes, we are asking open questions. And so you can see some examples here. You have the sheet with you, right, guys? ඔයාලගා මේ ටියුට් එක තියෙන නිසා ආයෙ මේක මුකුත් ලියාගන්න එම කරන්න දෙයක් නැහැ. ඔක්කොම තියෙනවා ඔයගොල්ලන් ගාව. So you don't need to worry about this. So these are some examples actually, open questions. The patient can give a story answer. And then the closed questions. Whenever you want to have some specific details, ask these details, ask these questions. So, can you cook for yourself? Has there been any change in your symptoms? Yes or no? So, most probably for the specific or the close questions, they would say yes or no. If not, yeah, most of the time. Yeah. So most of the questions are starting with do does, if not is are willing, has have willing, nathan, can could willing tamai good up questions start when. So if you want to ask a specific question, so follow the structure. Okay, so I'm not going for the grammar side, but yeah, you need to know how to ask the questions. Okay, so then this is another thing. So when you're doing the introduction part, remember to do it like more attractively. නේ දැන් හිතන්නකෝ අපි මොන දෙයක් කරත් අපිට ඕනනම් අපිට ඕනනම් අපිට එකම දැන් ලේඩි කෙනෙක්ට අපිට එකම සාරිය ඇඳගෙන ඕනනම් ඕන වෙඩින් එකකට යන්න පුළුවන්. මොකෝ ඇඳුමක් ඇඳගෙනනේ යන්නේ. නේ අපි ගන්නවා හොඳට සල්ලි දීලා හොඳ සාරියක් ගන්න. හරි හොඳට ඒකට ජුවලරිස් ටිකයි හොඳ ෂූ එකක් හොඳ පර්ස් එකක් මේ ඔක්කොම ටික හොඳට සෙට් කරගන්න. ඊට පස්සේ ඉතින් අවුරුදු ගාණක් යනකම් මේකම තමයි. ආයේ ඒක මොන පැත්ත යාළුවගේද නේද? ඒක මේ හස්බන්ඩ්ගේ පැත්තද ඒක ඔයාගේ පැත්තද ඒක මොන කාගේ පැත්ත වෙඩින් එක උනොත් ඒකම තමයි අඳින්නේ. So it may be beautiful for the first time. Second time උත් චුට්ටක් විතර okay. But after third time වෙනකොට what happened? It becomes normal and then it becomes repetition. You're repeating. එතකොට කට්ටිය කියන්න ගන්නවා. අර අරකමයිනේ අඳින්නේ. මම දැන් කරකටත් අඳගෙන ඉන්නවා. මේකටත් අඳන් ඉන්නවා එහෙම කියලා. නේ? The same thing happens when you're following the questions also. If you're asking the question for the same style, නේ? එකම style එකට questions අහන්න ගියොත් එහෙනම් මොකද වෙන්නේ? Repeat වෙන ගතියක් තියෙනවා නේ? Repeated. අර විදියටම තමයි යන්නේ. කිසි එකක් නැහැ. කිසි වෙනසක් නැහැ. කිසි change එකක් නැහැ. So it's boring. So don't be boring. Okay? So don't be boring. We have several methods to ask questions, right? So මේ තියෙන්නේ open questions අහන්න පුළුවන්, closed questions අහන්න පුළුවන්, and then plus with these type of questions. මේකේ බලන්න මේ question type එක මොකක්ද කියලා. මොකක්ද දන්නවද? We are introducing the subject first with the praise. Now you don't know how to write it. ලියන්න ඕනේ නැහැ. අහගෙන ඉන්නයි තියෙන්නේ. මොකක්ද බලමු. පළවෙනිටම මොකක්ද කියලා introduce කරනවා. මම මොකක් ගැනද අහන්න යන්නේ කියලා. Right. So there's an example. The nurse is saying, "What brings you here today?" "Well, nurse, I haven't been feeling well recently." "I'm sorry to hear that. Please tell me. I've been getting tired a lot." I see. So, what about your appetite? Are you eating well? This is what I said. Make it my monkey. I'm introducing the topic. What about your appetite? Mama, what about? How about? Echo what about? Echo how about? Kiela, make a home with the Kelahana. How about your appetite? What about your appetite? Kelahan. ඔයාගේ මේ appetite එක කොහොමද? What about your exercising? What about your eating habits? I'm introducing the topic and then ඊට පස්සේ I'm asking a yes no question එකක් මම ඊට පස්සේ අහනවා. මොකද්ද? Are you eating well? අපි ඔය සිංහලෙන් කතා කරනකොට මේ කියන්නේ අපි ටොපික් එක කියන මේක නෙමෙයි. මේ අර මේ මොනවද අපි කියමු. Can't remember anything now. Right? මේක නෙමෙයි. කොහොමද වෙඩින් එක? උදේට කැම එහෙම තිබ්බද? ඔන්න ඕකමයි. කොහොමද වෙඩින් එක? කොහොමද වෙඩින් එක? මට වෙඩින් එක ඕවර්ऑල් ගහන්න ඕනේ නැහැ මේ. කොහොමද වෙඩින් එක? කෑම හොඳයිද? මට අහන්නේ කෑම හොඳයිද කියන එක. හොඳයි තිබ්බා. Right? So I'm introducing my topic first, and then I'm asking a yes, no question. So this is another way of asking question. Okay? Right. Not really. I haven't felt hungry. Okay. What about your sleeping habits? Okay, so there's another question now. So what about your sleeping habits? Are you getting enough sleep? Make ahanna sudusuma tana tamai. Mokadda nada when you're asking questions and if the questions are not related to each other. Now see, now first you're asking about the appetite, right? Are you eating well? So if your next question is also about the eating habits or the appetite, then you need to introduce another topic there because the question is already related to the one you asked before. But this is a different question because you ask appetite first and then you want to ask about the sleeping habits. So two different things, isn't it? Two different things. And so it's better to introduce the topic then and then asking a yes, no question. Well, about 4-5 hours a night. Oh, it's really not enough, is it? I guess not. Okay, so how about your work? Okay, වැඩ කටයුතු වගේ වැඩ කරන තැන. So are you under any stress at the moment? So these are, if you want to ask, if from the cue card they are directing you to ask different sort of questions at a one time, then use this method. Yeah, that's a good method. Yeah, so are you under any stress at the moment? Yeah, a little bit. Yes, a little less. That is the end of the financial year, so I'm busy. So this is actually so we learn open questions. Yeah, we are opening. So whenever you are starting your conversation with the introduction, you're asking the open, and then we go for when you come to the, what is this? A medical history, taking medical history or asking social history questions. So then you can ask the closed questions. These are all closed questions. These are type of closed questions. Okay. So this is a closed question. But if you have to ask the questions in different set of things, so it's better to ask like that. Okay. So then we have embedded questions. This is something simple. And always we have to be really polite. So instead of asking, how did you injure your leg? So it's better to ask, could you tell me how you injured your leg? So is it a sharp or a dull pain? So would you please tell me if it is a sharp or a dull pain? Yeah. සමහර වෙලාවට අපිට direct questions අහන්න වෙනවා. සමහර වෙලාවට it's not always need to ask the embedded questions. Embedded කියන්නේ polite questions. We don't need to be every time to be polite like with a long part. So sometimes you can go for the direct questions as well. It doesn't matter. You ask the direct questions. So always try to have a mix of questions. I mean, like all your questions are not the same way. Okay, right. So yeah, these are some other things. Patients may need some encouragement. So sometimes if the patient is not telling anything more, so to encourage them, especially if the patient is a reluctant patient, persuade කරන්න නැත්නම් යා කතා කරන්න අකමැති කෙනෙක් නම්, so yeah, we can encourage them to give more details. Could you tell me more about that, Mary? Please tell me more. Tell me more about that, please, John. Likewise. Is there anything you would like to tell me? Likewise. Right. Then, The next set of questions are probing questions. Yeah, what does it mean by probing? Means you ask a question from the patient and the patient gives an answer, but it looks like the answer is not very clear. Yeah. And so now you're asking a question from the patient. So how about your water intake? Are you drinking enough water for one day? And the patient is saying, no, I take only a sip of water. What do you mean by that? Sip of water? What do you mean by that? I can't understand what it means. So the answer is not much clear. So in that case, you can ask like, what do you mean by that? Make a taraheng, narrowed when So what do you mean by that? Where exactly is the pain? Oh my God, it's really painful, my hand. Oh, likewise, if the patient is saying like that. So where exactly is the pain? Is it your elbow or the arm or the fingers? Where is it? You look a bit anxious. Is there anything else that is troubling you? So yeah, to get more information, the patient answered for the question, but it's not clear. But you need more. Yeah, so it's good. The answer probing. Can you explain exactly why you are worried? And the next thing is to ask the tag questions. So, if you're living in another country, you would know that most of the foreigners or the native speakers are using these tag questions. Even in English lessons in the schools, yeah, we are being taught about these tag questions. But yeah, it seems many of the speakers are using these tag questions. But if you're using this tag question, it seems like you're very fluent and it's like natural. So it's your first clinic to the clinic, isn't it? අපි අර අහන්නේ වගේ මේ ෆස්ට් ක්ලිනික් එකනේ. අර නේද කියන එක සමහර වෙලාවට නේද නේ කියන එක අපි සමහර වෙලාවට ඉංග්‍රීසි වලින් කියනකොට it's your first clinic. Sorry, it's your first clinic to the clinic, no? කියනවනේ සමහර වෙලාවට එහෙම. මොකටද අගට no කියනවා අපි. නේ කියන එකට no කියනවා අපි. සිංහලෙන් එනකොට නේ කියනවා. ඉංග්‍රීසියෙන් එනකොට no වෙනවා. ආරති වලනේ එහෙම කියනවා. Yeah, it's your first clinic to the sorry. It's your first clinic to the clinic, no? That's incorrect. That is Singlish. That's not English, it's Singlish. So that's not the way we are saying. That should be the correct tag question. So how do you get this tag question? It's if your first part of the sentence is positive, the tag should be the negative. It's not your first clinic to the clinic කියලා කිව්වොත් එමේ is it කියලා අහන්නේ. මේ පළවෙනි part එක negative නම් මේ part එක positive වෙනවා. Okay? You're here to get your blood results, aren't you? You haven't been taking your medication regularly, have you? Haven't? Have you, Veno? You didn't sleep well last night, did you? Your daughter is only 8 years old, isn't she? So this is very good if you practice the tag questions. I know sometimes it's very tricky, but if you practice to say the tag questions really faster, so it shows that you're very fluent in sense. Even if, yeah, it will help you a lot when you're speaking. Yeah. So the tag questions, okay. Is it causing you quite a bit of discomfort, isn't it? So these are actually the question types. Yeah. So you have the tute with you. You have all these with you. You can practice by yourself. As I said before, once we started the class, the practice session is the most important, right? Okay. Now, you know the question types, you know how to start, and you know how to greet, introduce yourself, and also how to get the permission or to let them know what you're going to do. And also, you know, how to ask the questions and also to summarize it. Yeah. So we're going to practice this part now. And after practicing session over, make it over, we'll move on to the next part. හරි. So what I'm going to do is just to find a cue card for you. මං cue card එකක් හොයාගෙන එනකන් ඔයාලට කරන්න තියෙන්නේ දැන් past notes ටික බලන්න කොහොමද මුල ටික මතක් කරගන්න. කොහොමද introduction එක ගත්තේ? කොහොමද ඉතුරු parts ටික කරේ කියලා චුට්ටක් බලා ගන්න. ඒ බලා ගන්නකම් මං cue card එකක් අරගෙන එන්නම්. Okay, so I have a really a short one, and so I believe that this is easy. As I'm going to be the patient, I need some informations to be there in my desk. So I'm going to write my answer here, the details, right? Yeah. Okay, I got my details. Right, I'm going to show you now my cue card. Right, so if you're ready, you can raise your hand. Yeah, I'm going to give some comments against your speaking. Yeah, I'm going to share my screen. If you're ready, oh, steady. Ready, steady, go now. අත උස්සන්න. අත උස්සලා මට කියන්න. Okay, I'm ready to give the chance. Now you can see my cue card question and also what you have to do. This is just only the first thing you need to do. Find out about his or her, so probably me, it's her, vaccination history about the tetanus, hepatitis A and influenza or the flu vaccine, and also the duration of my travel. Yeah, so these are the informations you have to take it from me. So I'm not telling anything now, how to start, what is it, or anything for you. It's up to you to decide. Yeah. And yeah, we'll see how it goes. And then after that, I can give sample and we'll discuss the pros and cons. Yeah, I have two, and I'm waiting to get more. Oh, I have more, right? Yeah, just give me 1 minute. I'm gonna start. Okay, we'll start then. Okay, we'll start from Miss Gayatri, right? Right, okay. So Miss Gayatri, shall we start then?
Yes.
Beautifully. Yes, okay, we'll start then.
How may I address you, Miss, while
You
doing
can call
the?
me Sachi. Yes.
Okay, thank you.
Okay.
Hi, how are you, Miss Sachi? Are you doing okay?
Yeah, I'm good. Good.
Yep. Yeah. You're here for the 10:30 appointment, are you?
Yes.
Okay. I can see that you have booked an appointment for your routine checkup. Is that right?
Yes, right.
Is there anything else to bring you here today other than your checkup?
No.
Mm. Okay. And your details shows me that you're going to travel overseas next month
Yeah,
for
that's
your
correct.
work.
Yeah, that's
Yeah.
correct. Yeah.
Okay. So, can I get for the details because which countries you're traveling since you have to take your immunization um injections prior to your travel. Is that all right?
Yeah, that's okay.
Yeah. Can I get more details
Yeah.
about it?
Yeah.
Yeah. Have you been to any other countries before? Like, have you taken any vaccinations before you're traveling?
I have never been to another country, but so I have taken some vaccinations actually. So yeah.
Okay. May I know, if you don't mind, what type of vaccinations do you have taken earlier
Right.
during your
Okay. So
travel?
to be honest, actually, yes. I have taken the flu vaccine last year, if I can remember well. But
Okay.
I can't recall the memory of when I have taken my tetanus and hepatitis A.
Okay.
So yeah, I can't remember exactly what date was it, but I could
Okay.
remember, as I could remember, it's like in my childhood, it's because it's like 30 years ago, I think.
All right. That is influenza and tetanus, hepatitis A, if I'm right. Is that right?
Yes,
That,
that's correct.
okay. Thank you so much for your information.
Right. Okay, miss. Yeah. 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 It was all good. Yeah, the pronunciation, introduction. I think you're working in a country, I think so. It sounds like that.
Um, I'm
Yes,
here
you
in
are.
UK.
Yes. So it sounds like that, yeah, you're being really polite with your patient and also you're checking the appointments and the appointment time and all. That's so practical, and also the name, the consent taken, the permission, and you let them know. The thing was, yes, you asked two questions at one time, which means have you been to
Yeah.
other countries and the vaccinations? So if you ask those
Yeah.
two questions in two times, that's all good. Yeah, miss? You got it,
Yeah.
right?
Thank you.
Yes, and
Thank you.
also, yeah, and also, as it's all about the vaccination, so you got confirmed from me. It's all about
Yeah.
the vaccinations and all. That's good. Yeah, good.
Thank you.
Okay, then. You're welcome. Right. So we'll move on to Miss Irosha then. Shall we start, Miss?
Yeah, yes, okay. Hi, I'm Irosha. I'm the community nurse today. How are you?
I'm good.
Could you please tell me your full name and date of birth, please?
I'm Sachitra, and my date of birth is 28 March 92.
All right. How can I call you?
You could call me Sachi, yes.
Oh, okay, all right, Sachi. Today I can see that your immunization card. And could you tell me your working history for next few months? Is that okay with you?
Yes.
Okay, I can see that you are traveling with overseas next month. Could you please tell me which countries do you travel?
I travel for Cambodia and Vietnam.
All right, okay, Sachi. And also, I can see that your immunization, vaccination history, and also I can see that you had tetanus 2 years ago. Is that all right?
What do you mean by tetanus? I
Yeah.
had tetanus.
Okay. So I think you no need to do administration tetanus. So I can see that hepatitis A and influenza and flu also I can administer for you before traveling to your work. And also I will escalate this GP for your vaccination history. Thank you so much, Sachi. And could you please tell me any allergy history or any medical history for you?
I'm not allergic to anything.
All right. Okay. And I can also, I will escalate the vaccination history for your GP. And after that, I will administration you. All right, Sachi?
Yes.
Okay, thank you so much.
Right. Okay, Ms. Irasha. In that case, yeah, your pronunciation, the way you're speaking is totally correct. But if I go inside, yeah, you introduce yourself and ask my date of birth and my name, the full name, and also how could you ask? How could you to call me? Yeah, that's all fine. But the problem started then after that. So I couldn't take the whole sentence, unfortunately, because while I'm listening, while I'm answering for your question, I have to write it down. So, you said something like, could you tell me your working history or something? And then you said, is that all right? Yeah. So, we have to say, is that all right? Or is it okay? When we are saying something, not where we are asking to do. So I don't know whether it's clear for you. Now, you ask a question from me. Could you, it's something like this, okay? I can't remember the whole phrase. Could you tell me about your working history? And then you said, is that all right? So that's not the correct way of saying. Yeah, if you say, can I take your working history? If it's all right, that's correct because statement and then you're whether checking whether that is okay with the patient. Yeah, asking a question and saying, is that all right? That's not the correct way. And then after that, I think you have not read the scenario first because here it says, now actually the GP has asked you to advise this person to take the immunization prior to international travel. Yeah, so you say that I can see you have taken the tetanus, hepatitis, and influenza. Like how do you know? How do you know whether this person has taken? Because you're here to ask that question because the task is find out. කියලා නිති එන්න මෙතන. එතකොට ඔයාගේ රාජකාරිය තමයි to ask that question whether you have taken the vaccination or vaccine අරගෙනද තියෙන්නේ tetanus වලට, hepatitis වලට, influenza වලට අරගෙනද තියෙන්නේ සහගේ duration එක කොච්චරක්ද කියලා අහලා දැනගන්න ඕනේ. You can't say that I can see that you have taken it because where you have taken that history. Maybe that is in the system, that's practical, but in here, you're asking the questions, okay?
Yeah, so
Okay,
actually
fine.
my first time I
Oh,
participated this.
no, that's all fine, miss. Yeah, don't take it like personal, right? I'm just saying what you have to do. Yeah, so it's yeah, I really appreciate that you present and you are asked and you performed. So when we're doing the things, actually we learn things, yeah? Right, so yeah. Thank you very much, miss. Yeah, okay, right. So from these, actually, the other students also learning. So it's a good chance actually to learn. So yeah, that's why I'm giving the explanation once after you did. Yeah, so the next chance goes to Miss Iddagoda.
Yeah. Good
Yes.
morning. Good morning. I'm Lakmini, and I'm one of the registered nurses in this general practitioner clinic. Am I right into thinking that you have been referred by your doctor for your travel immunization recommendation? Am I
Yes,
correct?
yeah, you are. Yes.
Before proceeding furthermore, could you please tell me your name and age for the documentation purpose?
Yeah, sure. I'm Sachitra, and you can call me Sachi. So my date of birth is 15th of May, 1980.
Okay, thank you for giving information. And are you going to travel for your working purpose, aren't you?
Yes.
Okay. Have you ever had your any vaccination?
I have had some vaccinations. Yeah. Yes.
Uh, could you please tell me about what you taken for vaccine?
Oh yeah, of course. To be honest with you, I got my flu vaccine last year, at the end of the year, but I can't
Yeah.
remember exactly the dates that I have taken the tetanus and hepatitis, because I've taken those vaccinations early in my childhood, so it would be probably like 30 years ago.
Yeah, thank you. I noted it. And could you please tell me what is your duration for this travel?
It's gonna be like 4 weeks.
Okay, thank you very much for giving information.
Yeah. Yeah, that's all right.
Thank you.
Yeah. Okay. So yeah, the greeting, the introduction, and also you said for I mean, like the starting point is really good, because it you give a kind of a sense that the GP referred you. Yeah. Yes. So it means like from where this patient comes and for what reason the patient is referred. But that's really nice. And also you answer date of birth. So yeah, actually, yes. Yeah. So practically most of the places they answer the date of birth, and සමහරක් වෙලාවට ගොඩක් වෙලාවට තහවුරු කරගන්න අහන informations ටික තමයි mobile phone ending numbers අහනවා, and first line of address අහනවා, and date of birth අහනවා. ටික තමයි අහන්නේ. මොකද හැම දෙයක්ම systems වල save කරලා තියෙන නිසා. So you ask the date of birth and my name. Right. So yeah. And also yes, you asked some questions from me. So the first question was like, are you going to yeah, are you going to කියලා question එකක් start කරා. ප්‍රශ්න තියෙන මට ඇත්තටම ළමයි ලියා ගන්න අමාරුයි. ඒ දිගට තප්පරයට ඔයාලා sentence එක කියනවා. At the same time I need to write it down. I want to answer. I want to listen to you. So three things at a one time. සමහර වෙලාවට full phrase එක ගන්න බැරි වෙනවා. So මට catch වුණ දේ තමයි ඔයා tag question එකක් පාවිච්චි කරන්න ගියේ. That's good. Really nice. I really appreciate. But එතන පොඩි grammar mistake එකක් වුණා. මොකක්ද දන්නවද මිස්? tag එක හරිවා aren't you කියලා දැම්මා. ඒක හරි. tag එක හරි. But ඔයා මුලින් ඇහුවේ question එකක්. are you කියලා. question එකක් අහලා tag එක දාන්න නැතුව you are going to statement එකක් කියන්න. Yeah? You are කියලා ඉතුරු part එක වගේ. So you're going to you're going for what is it? You're traveling overseas, aren't you? Anhim. Statement and the tag question, okay? Not the question and the tag. So that's what. And tag. And also you ask what's your duration? Okay, so yeah, that's what you ask. That's good. But so this is common for all. But may හැමෝම කරපු වරද්දි දෙකක් තියෙනවා. ගොඩක් කට්ටිය ගොඩක් අය කියන්නේ දැන් තුන්දෙනානේ කරන්නේ. සමහරක් අය they haven't tell me what they're going to do. So before asking the questions about these vaccinations or the duration, you have to let me know, the patient, that you're going to ask or to take this vaccination history. And after taking my answer, it's better if you can summarize it. Yeah, this is what you said. Because it's all about the vaccination, about the injections. So I said for you, if it is something related to the medications or the what is this? Injections. If you administer a kind of medications, drugs, so it's better to clarify the informations. Yeah, right. So I'll give another chance. Yes, Miss Sirivardhana is there. Shall we start, Miss?
Yes.
Yes.
Good morning. I am Ishani, one of the registered nurses in this GP clinic. Before proceeding further, may I know your name, please?
Sure. I'm Sachi. You can call me Sachi.
Okay, thank you. And also your date of birth, please.
It's 29th for the September 1940.
Thank you, Miss.
Yes.
Okay, Miss Saji. Am I right in thinking that you have been referred by the doctor to discuss about your immunization prior
Yeah, that's
to your
correct.
travel?
Yeah, that
Okay,
is correct.
okay,
Yeah.
noted. First of all, if you don't mind, I would like to ask few questions regarding your vaccination history. Is it all right with you?
Yeah, that's okay. Yeah.
Okay. Have you ever been to overseas before?
No, to be honest, no, this first time.
Okay, it's all right. Which country you are looking to travel this time?
It's Vietnam and Cambodia, yes.
Okay, thank you. And also for better understanding, I would like to know about your traveling furthermore. How long you are going to stay?
It's gonna be like 4 weeks, yeah.
Okay, thank you, Miss. And also I would like to ask you questions regarding your vaccination history as well. Have you ever had tetanus or hepatitis A or influenza vaccine?
Yes, to be honest with you, I have taken the flu vaccine last year, so it's already updated. And yeah, if I recall my memory, about the tetanus and what is it? Hepatitis A, right? Yeah, hepatitis A. I can't remember exactly when I was taken it, but to be
Okay.
honest, I can remember I have taken these vaccinations in my early childhood, like maybe like around 30 years ago, but I'm fully vaccinated.
Okay, Miss, it's all right. We will check in the system as well with your details, and then we will proceed further. If you are not having any vaccination, we will arrange to get you. Okay?
Yeah.
Thank you so
Sure.
much.
You're welcome. So it was all good, miss. Yeah.
Thank you.
Very nice. Yeah, that is what I expected. So yeah, so who was that? Miss Sirivardhana, right? Yeah, that was really good, miss. Yeah, the way you started the greet and clarifying some informations, and also GP referred, and it's first time that you asked some questions, the duration, the countries, and also about the vaccination history. So that's all good. Really nice. Yeah, I appreciate that. That's a
Thank you,
good
Miss.
one. Yes, it is. Right. Okay. So we'll move on to Miss Jail up next. Yeah.
Yes.
Yeah.
Hello. Hello, good morning. I'm K.H.I. Jairat. I'll be your attending nurse today. How may I address you?
Call me Sachi, please.
Okay, okay, Sachi, thank you. You are in here to your routine checkup, aren't you?
Yeah, actually, so my manager told me to come here because GP has asked me to get some advices against my immunizations. I don't know why he referred, but I came.
Okay, thank you. Your GP has asked about your traveling, your journey to overseas. First of all, if you don't mind, tell me your name and age, full name and age for the recording.
Yeah, I'm Sachi and I'm 40 years old.
Okay, thank you, Miss Sachi. Please let me know about your traveling. Please tell me what are the countries would you go?
Yeah, I'm traveling Cambodia and Vietnam this time.
Okay, and also let me know the time period would you stay in that country?
It's 4 months, sorry, 4 weeks. So
Okay, okay, Sachi. And also let me know about your vaccination history. Please tell me, did you get vaccination for tetanus, hepatitis A like that?
yeah, hepatitis A and tetanus. It was like not recently, but I can't recall exactly the date. But I don't know whether it's in the system, so probably like 30 years ago.
Okay, I will refer system and I will get information about further information, and also let me know influenza vaccination history.
Yeah, I took my flu vaccine last year.
Okay, thank you. It's good. Yes, I'm going to give vaccination if you don't get vaccine properly in your yes in your age. I will check system and after that I'll arrange to administer vaccination to you. Thank you for sharing this information.
Okay, Miss Jaira, right. Is it your first time? It seems like you're nervous sometimes. Right, okay. So I know that you know what you're going to do. Yes. And you are in a hurry to finish the part. Yeah. So don't be in a hurry. And with that hurry, අර ඉක්මනින් ඉවර කරන්න තියෙන rush එක නිසා ඔයාලට චුට්ටක් පැටලෙන ගතියක් එනවා. Yeah, that's what I felt. Yeah, but you know what you are going to do. ඔයා දන්නවා මොකද්ද කරන්න ඕනේ කියලා, but because of the quickness you have, so sometimes you're not, what is this, working properly, right? So yeah, you asked my name and also some kind of other questions related to this scenario. That's good. But don't ask the age from the patient, Just ask the date of birth. It's not good to ask the age. That's not good. Okay? So, and the other thing is, you repeated a part. Let me know. Let me know කියන part එක මේ සතුණු වතාවකට වැඩි repeat කරා. Okay? So repeat part එක ඔන්න පොඩ්ඩක් අඩු කරගන්න වෙනවා. ඒක note වෙනවා. අර එක ළඟ repeat පොඩක් repeat වුණාට කමක් නැහැ. එක පාරක් දෙපාරක් කිව්වට කමක් නැහැ. But if something is going like more than 3 times, even continuously, even it like, yeah, continuously, so it's get noted. So let me was repeated like more than 3 times. And yeah, sometimes the way you're asking the questions, so especially the duration, and sometimes you have to ask the duration, but sometimes you don't get how to ask it properly sometimes. Maybe because of the quickness, hurriness that you have. අර ඉක්මනින් අහන්න ඕන නිසා පැටලෙන ගතිය තමයි මට ගොඩක් තේරුනේ. ඒ නිසා ගොඩාක් ඉක්මන් වෙන්න එපා. Take your time and just say it, because now we are practicing, okay?
Okay, thank you.
Thank you. You're welcome. Right. Yes. So we have Miss Ajanta now. Yes, Miss, you can start now.
Good morning. My name is Ajanta Kalyani. I am one of the registered nurses in this clinic. Okay. Before proceeding further, I would like to ask you some questions about your personal details, isn't it?
Yeah.
May I know your full name and address for the recording, please?
I'm Sachi. You can call me Sachi.
Miss Sachi, am I right in thinking that you have been come to routine checkup before you traveling?
Yes.
Could you tell me your past vaccination history?
Yes. So if I start with the flu vaccine, if it is account for this, so I took the flu vaccine last year, at the end of the last year, so it's updated, I think. And also, yeah, about the other things, which comes to my mind about the hepatitis A and tetanus. I have taken all these vaccinations in my childhood. So it would be like 30 years ago. So however, I have completed all vaccinations.
Thank you, Miss Sachi, giving your information. That's enough.
Okay, right. Okay, Miss Ajant, I appreciate your present. Yeah, I really appreciate that. However, you took your chance. Yeah, and I know that you're just reading some sentences. That's all fine. This is just the start, but you're practicing. Yeah, so I really appreciate. එකක් බලාගෙන කිව්වා කියන එක මට එක note වුණා. ඒක මොකද අපිට සමහර වෙලාවට ඒක felt වෙනවා.
My
But
first
it's okay.
chance, Miss Sachi.
No, that's okay. That's okay. I'm not saying that don't do it like that. So මං කියනවා point එකක් මෙතනින් එහාට ඒක කරන්න එපා කියලා, but now it's okay because we are practicing. Yeah, that's fine. So that was something I noted, another thing, right? So again, yeah, you try to use a tag question, but it went wrong. Okay, so what I was trying to tell, you started your sentence by saying, I'm going to ask, so මට එච්චර note කරගන්න පුළුවන් something like this මට මතක විදියට I'm going to ask some personal questions or vaccination history details from you, isn't it කියලා ඔයා කිව්වා. Yes, හරි. එතන වැරද්ද මේකයි මිස්. අර මුලට එන ග්‍රාමර් එකක් තියෙනවනේ. ඒ කියන්නේ I am කියලානේ පටන් ගන්න. එතන am කියලා තිය එකක් තියෙනවනේ. be verb එකක්. ඒ be verb එකමයි tag එකට එන්න ඕනේ. එතකොට ඔයා I am කියලා statement එක start කරොත් ඔයාගේ tag එක වෙන්න ඕනේ මේකේ negative හදා ගන්න ඕන නම් am I not නේ? අපිට ඒක කෙටි කරන්න බැහැනේ am I කියන එක. Sorry, කෙටි කරන්න බෑනේ is isn't කියනවා වගේ කෙටි කරන්න බෑනේ is not කෙටි කරන්න පුළුවන් isn't කියලා. But am not කියන එක අපිට කෙටි කරන්න බෑ. So ඒක full format එකෙන් යන word එක. එතෙන්ට isn't it කියන එක ගැලපෙන්නේ නැහැ. Isn't it එන්නේ ඔයාගේ sentence එකේ මුලට is කියන word එක තිබ්බොති. You got it? Yeah, ඔයා ආපහු මේ අර slide එක බලන්න. ඒකේ තියෙනවනේ sentence අර ටිකක් examples ටිකක් දාලා just read that. But I really appreciate the what is it? උත්සාහයක් ගත්තා ඒක use කරන්න. ඒක වැරදුනාට කමක් නැහැ. අපි ඊළඟ පාර එක හදාගමු. Okay?
Thank you.
Right, you're welcome. Yeah. But මම ඇත්තම appreciate කරනවා වැරදි කරන එක සාමාන්‍ය. වැරදි කියන අපි ක්ලාස් එක ඉගෙන ගන්න ඇවිල්ලා තියෙන්නේ. ඒක personal ගන්න එපා. අයියෝ මට වැරදුනා. එහෙම නෑ. එහෙම නෑ. එහෙම කරොත් එහෙම අපිට කවදාවත් practice වෙන්න තැනකුත් නෑ. අපිට practice වෙන්නත් බෑ. So don't take it too much, but just learn it. Right. Okay. So I have two more to go. Yeah. The first one is, yeah, the Sewandi miss. Yes.
Okay, miss. Hello, good morning.
Hmm.
Hello,
Good
I'm
morning.
Sewandi and I'm your attending nursing officer today. So may I know your name, please?
Yeah, sure. I'm Sachitra. You can call me Sachi.
Okay, Miss Sachi. For only documentation purpose, I want to know your full name and date of birth, please.
So my full name is Sachitra Madhushani, and the date of birth would be 30th of July 1942.
Yeah, thank you. As I know from your GP, you are going to travel overseas next month, aren't you?
Yes, I am.
Yeah. Actually, immunization is compulsory prior to the international travel. So I want to clarify your immunization history. Is it okay with you?
Yes, it is.
Yeah. Did you travel in country before this? And may I know what were they?
I haven't. No, I'm sorry.
Yeah. Okay. Okay. So what are the countries you are waiting to travel?
It's Cambodia and Vietnam. Yes.
Yeah. So the main thing is, do you remember your vaccination history, such as tetanus, hepatitis, and influenza?
Yeah, for the influenza, yeah, it was last year.
Yeah.
At the end of the last year,
Okay.
I took the influenza, the flu vaccine, and
Yeah.
hepatitis A and tetanus.
Yeah.
Not recently, but I have taken it in my childhood, so probably 30 years ago.
Yeah. Thank you. It's all right. So I'll check your records of the database. And thank you, Miss Sachi, for your kindness.
Okay, that's the end then. Right.
Thank you.
Yeah. That was yeah, that was good because mandatory parts were covered. Yeah. අවශ්‍ය කරන parts ටික cover වුණා එතන. Miss Ewandigen, great introduction, asking name, the clarifying travel history, and also the the other parts. Yeah, that's okay, but yeah, it's okay. Right, so we'll move on to the last. Yeah, Miss Veerasekara, හරියට පස්සේ මෙයාගෙන් මේ මිස්ගෙන් පස්සේ අපි කතා කරමු කොහොමද මේක හරියටම කරන්න ඕනේ කියලා. හොඳේ? Right. Okay, start, Miss.
Hi, good morning.
Good morning.
Please sit down. I'm your nurse today. And may I know your name and birthday, please?
Yeah, my name is Sachi Trag. You can call me Sachi, and my date of birth is 20th of September 1945.
Okay. I'm just going to ask you a few questions. Is that okay?
Yeah, sure.
If you don't mind, let me know some information about your traveling history.
Yeah, sure. I have never been to another country, so this is my first time traveling overseas. It's for the business purpose. I'm visiting this time Vietnam and Cambodia as a business trip.
Okay, that's good. And have you ever taken any vaccine before?
Yeah, I've taken some vaccinations. So I could remember I have taken flu vaccine last year, and for the hepatitis A and tetanus, if I'm correct, I took it like in my childhood. So probably like 35 years ago.
That's good. And from what I have understood so far, you have taken all the vaccines, including tetanus, hepatitis A, and influenza flu. And thank you for your information.
Yeah, that's good. Right. Yeah, that was a really good, Miss. Yeah. So you started, and also, yeah, but birthday කියලා අහන්න නැතුව date of birth කියලා අහන්න. It's like birthday for the celebration likewise. So it's better to ask date of birth, but you granted the permission and also took the vaccination history and also the travel history, and also you summarize some details. So that's good. Yeah. Right. Okay. So we'll see how to do it properly, actually, right? I'm going to show you this thing. Yeah. We'll read it together. Yes. Okay. So I'm going to highlight. Can I? Okay. Yeah, good morning. Thanks for coming to see me. My name is Caroline and I'm the clinic nurse. What do you prefer to be called? Right. And then what I'm going to do next is I'm just confirming. Yeah, because I have the details. Because if the GP, because GP can so this person has an appointment. But appointment and the person is coming to the right appointment, which means I have the details. So I'm confirming whether this is the correct patient. Okay, team, the doctor has informed me that you'll be traveling overseas next month. Is it right? Yes, I see. So we are asking the duration. So how long are you going for? Answer the patient answering. Right. Okay. So now, yeah, before asking the immunization or the vaccination history, make an immunization. The immunization we can use that word here. So we could ask, okay, the doctor has asked me to ensure that your vaccinations are up to date before your trip. So can I ask you some questions about immunization history? Yes. Okay. So the nurse is asking this question. So the nurse is asking, tell me when you received the immunization for tetanus, flu and hepatitis A. අපි mention කරන්න ඕනේ මොනවද කියලා. නිකම්ම කියන්න ඔයාගේ vaccination history එක කියන්න කියලා කිව්වොත් එකපාරට මෙයාට මතක් වෙන්නේ නැහැ මෙයා මොනවටද විදගත්ත කියලා. You have to mention the name. So then the person is answering right. Okay. So, and then what I told you is just to summarize. Then I summarize kare, but it's necessary to summarize the details. So, okay, so what I'm saying is that you have had a flu vaccine earlier this year and have not repeated vaccines for hepatitis A and B or tetanus since your childhood. Is it right? Yeah, that sounds right because as you all are professional nurses, you know that if they have taken these type of vaccinations, so it's better to get updated ones because it was like all like 30 years ago that this person has taken the vaccinations. The නිසා යන්න කලින් එක කරගන්න එක හොඳයි. මොකද මේ country වල මොකද කාම්බෝජියා and වියට්නාම්ස් වල ගොඩක් මේ ආශ්‍රිත ලෙඩ රෝග බහුලව පවතින නිසා නේ. Yes. Both medium risk countries as per the World Health Organization. Ne? Enisa risk එකක් තියෙන නිසා it's better to advise. Enisa මේවා injections, drugs ගැන සම්බන්ධ දේවල් ගැන නම් ඔයාගේ මොකක්ද මේ role play එක යන්න it's better to summarize the details. So ඒක කරේ බොහොම කීප දෙනයි. හරි? So make sure that you are doing the proper steps. Okay? So I'll remember it again. මම මතක් කරන්න ආපහු මොනවද කරන්න ඕනේ කියලා. Greeting part, the introduction part, and the introduction part varies according to the type of the situations. කොහොමද ඒක මාරු වෙන්නේ? Yes. එක තනානුව මාරු වෙන්න පුළුවන් inpatient outpatient කියන එක මත වෙනස් වෙන්න පුළුවන් ඊළඟට refer කරපු appointment එකක් දාපු patient කෙනෙක්ද known කෙනෙක්ද unknown කෙනෙක්ද මත introduction එක වෙනස් වෙන්න පුළුවන් අපි කරන. And then if you need to ask questions, so then it's better to let them know what you're going to do, just to outline what you're going to do with the patient, and then ask the questions one at a one time. And then after you have taken the information part, you have to repeat it. So the summarizing part, this is what we have learned so far. ඔන්න ඔය ටික තමයි අපි මේ දවස්වල ඉගෙන ගත්ත parts ටික. right මම මං හිතන්නේ ඔයගලන්ට මෙන්න මේ ටියුට් එක දාලා නැහැ. මේක මම ඔයගලන්ට next year next year මේ දාන්නේ මේ කවද්ද ඊළඟ දවසේ එනකොට මම ඔයගලන්ට මෙන්න මේක තමයි දාන ටියුට් එක. හරි? It's all about the next step. මොඩි දේවල් ටිකක් කියන්නම්. දැන්ට ඔයගලන් ගාව මේක නැතත්. So it's all about the providing information. So I'll upload this one as a tut for you guys to know more informations, and also it has more informations. It has more phrases. So after gathering informations, the explanation part comes. නේද ඊළඟට ඕගලන්ට තියෙන explain කරන්න කියලා. දැන් explain කරනකොට දැන් කොහොමද අපි යම් දෙයක් යම් කෙනෙක්ට පැහැදිලි කරන්නේ? කියන්නේ ඔයා ගාව ඉන්නේ patient කෙනෙක්. නේද? ඔයාගේ ඉස්සරහින් ඉන්නේ patients. Now remind the way you are explaining something for your patients. There are some sort of patients who don't understand what you're telling. If you're telling something like continuously, නේද? step by step කියන්න නැතුව එක දිගට කියාගෙන ගියොත් සමහර patients ලට ඔයා කියන දේ තේරෙන්නේ නැහැ. So most essential දේ තමයි provide informations provide කරන part එකට ගියාවහම we have to provide the information chunk by chunk කරලා පොඩි කැලි වලට කපලා අපි කියනවා chunk කරනවා කියලා. අපි කියනවා chunking කියලා. So we have to chunk our informations. Yeah. Now for example, if I'm explaining the way to inject insulin by themselves, so that's a whole procedure for them. Have to put this insulin inside to the injection, and how to select a spot, and how to inject it, and in what angle, how do I how the patients have to clean that part, and after injecting themselves, how can I dispose it? So likewise, yeah. So as we have 5 minutes, I'm going to show you a small video clip. Yeah, I'm going to show you the video clip and we'll see how this person is explaining. And I'm not telling that this person is 100% like OET B එකක් OET A එකක් ගත්ත කෙනෙක් කියලා මම කියන්නේ නැහැ, because there are some mistakes she is doing. එයා කරන mistakes ගොඩක් තියෙනවා. But even though she's having some mistakes, I thought I would show it to you, because just to get an idea how that you need to perform. Yeah. Okay, just wait for me. I'm going to show it to you. Yeah. It doesn't take much time. Okay. Yeah, wait. Yeah, I'm going to show it now. Playing now.
Patient or perhaps a relative, you'll take the professional role. So each role play will last 5 minutes, and the purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, thanks.
Excellent. So you have up to 3 minutes to prepare the first role play. You will start the role play after that time. You'll know when 3 minutes are up. You can ask me if there's anything you're not sure about, and make notes on the role play card. If you want, there's a pencil for making notes. You can look at the card during the test, but must return it to me at the end of the test. This is your information for the first role play, and the role play number 1 for profession of nursing. Please start preparing now. Thank you. Thank you. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play now?
Yeah. Hi, my name is Mary. I am one of the nurses from the hospital. I came today because the doctor needs you to start insulin. So what do you feel about that?
Well, to be honest, I'm a little bit nervous about the idea of starting insulin injections.
Okay. I can understand it's really new for you to inject yourself with insulin, but I'd like to reassure you that it's easy and it's straightforward. So I will explain to you how to take the injection, and you will be fine. So, yeah.
Is there any other way? Is there another thing we could possibly do?
About the diet and anything oral tablet, I think it's not the good option for you at the moment, because your the diet is not controlling your the sugar level in your blood. So the insulin injection is the best option for you at the moment. It will control your blood sugar level and bring your blood sugar level at the normal level for you. So I want to reassure you that it's very easy to take insulin injection, and I can explain to you how to take it. So can you let me to tell you?
Yes.
So in the beginning, you will take the insulin injection. You open it and check the correct dose and the date of the on the needle, and if it's right and if it's the right dose, the doctor tell you, and then you check on your tummy. So choose any spot you like, and then try to squeeze your tummy like this, and then put your needle.
Okay.
But I would like to explain that you need to change the spot, so you don't use the same spot for every time. So you need to change the spot, one time here, one time there, so you don't have the bruising and this kind of painful area. Yeah. So what do you think about that?
I mean, I guess, as you say, I have to because my diet isn't working
Yes.
to control my insulin.
Yeah.
I still feel a bit nervous about it, but I guess I could give it a go.
Yeah, and the insulin.
Right. Okay. So to now, it's all that you're gonna brush. Yeah, it gives you kind of a understanding how that you have to start, and yeah, how that how the examiner is asking, how she is performing in front of you, and yeah, how that she is giving instructions, and then you are going to start. So yeah, so we'll discuss more next week. Yeah, hope to see you again on next week, on next Saturday. We're meeting again with a new set of lessons, right? With the reading and the speaking class, and hope to see you. Right. So good night, everybody. Thank you for being with us. Yeah. Thank
Good
you.
night,
Bye.
Miss.
Good
Good
night.
night.
Good night. Bye.
Good night, Miss.
Good night, Miss.
Come.
Good night, Miss.